Hello, happy Earth Day, and thank you for joining us for this inaugural Keystone Symposia ePanel discussion on the impacts of climate change and health. I'm Dale Jarvis, Chief Scientific Officer at Keystone Symposia, and I'd like to welcome you to this event. Keystone Symposia has a long history of programming outstanding events in the life sciences, largely focused on the underlying molecular and cellular mechanisms that drive fundamental biological processes involved in health and disease. This ePanel is a collaboration and initiative with the Global Consortium on Climate and Health Education. This is the first in a series of virtual events focused on specific aspects of climate and health, and arises from a broad recognition that climate change is a growing contributor to a variety of health-related concerns, from air quality and respiratory health to infectious disease and heat stress. We also recognize that these health impacts fall unequally across various populations, raising concerns about health equity and the need to build resiliency in our healthcare systems to address systemic inequities arising from climate change. This ePanel series is part of a larger initiative at Keystone Symposia to lower our carbon footprint and democratize access to compelling scientific content through an expanding offering of virtual content. With that, I'd like to welcome Cecilia Sorensen, the Director of the Global Consortium on Climate and Health Education.
Thank you so much, Dr. Jarvis, and I want to give a huge thanks to Keystone Symposia, to our panelists, and to all of you who are here with us in this virtual space today on Earth Day. It's fantastic to be here, and I'm so excited about this collaboration. I am an emergency medicine doctor by training and currently the director of the Global Consortium on Climate and Health Education. We are a group of over 260 health professional schools from 40 different countries who have pledged to train their health professionals on the health impacts of climate change. We represent schools of nursing, schools of medicine, dentistry, veterinary medicine, and we've all come together around this urgent global need to understand what the health impacts are of climate change and how we can strengthen our health systems in order to protect human health everywhere, and especially the health of vulnerable populations. So this is a really exciting collaboration with Keystone Symposia. We're bringing some of the greatest minds together to really think about how our communities can interact and how we can advance climate solutions everywhere. So as part of this initiative, we have a 5 ePanel series. The first one is today. There'll be 4 more unrolling in the next few months. Additionally, we're creating a master class some series, which will introduce you to some of the key areas of climate and health heard from the mouth of some of the experts in the world on this. So I'm delighted to kick off our panel today. We will be talking about climate and health impacts, disparities, and future directions. And I can't think of a better person to be our moderator for this, Dr. Marka-Lee Alexander, who is the editor-in-chief and the founder of the Journal of Climate and Health, and also a dear friend. So thank you so much for being here today, and I will turn it over to Dr. Alexander. Thank you.
Thank you so much for allowing me to be here today, Cece, and to all of you from Keystone. Today is such an important day, Earth Day, and I could not think of a more important topic than climate change and health. And as representing the journal and also the nonprofit Sustain Our Abilities, again, thanks for having me here. The Journal of Climate Change and Health is a worldwide scientific peer-reviewed gold open access medical journal. We seek to publish high-quality scientific works related to both acute and chronic-related climate disasters, migration, changing patterns of disease, and the impact of climate change on people and health systems. We want to publish articles related to best practices and solutions for climate change and health. This might be something like telemedicine, developing reusable supplies, developing environmentally friendly treatments for illnesses and issues related to sustainability in healthcare and research. We target all aspects of health from all medical disciplines, from infancy to aging and individual organ systems. We also emphasize issues like what we're speaking about today, issues related to environmental justice and how they relate to health. Our goals are to serve researchers and clinicians as a place and a home to publish scientific and clinical manuscripts related to climate change and health, to to promote professional and general communication about the immediate and long-term effects of climate change on humans, and to encourage people to investigate the impacts of climate change on human health, both individually and in a population-based fashion. We want to be a forum where environmentally sound systems of healthcare are enhanced, and where the effects of climate change on people in different geographic locations and from different socioeconomic backgrounds can be supported. And most importantly, to raise awareness of the varying impacts of climate change on human health. I'm privileged now to introduce our speakers. You've met Dr. Sorensen. She is the director of the Global Consortium on Climate and Health Education at Columbia. She's also an associate professor of emergency room medicine at the Columbia Irving Medical Center and an associate professor of environmental health at the Mailman School of Public Health. She went to Drexel University for her MD and did an emergency medicine residency at Denver Health. After this, she did a 2-year fellowship in climate change and human health policy with the National Institute of Environmental Health Sciences. Her work focuses on the intersection of climate change and health and how policy solutions, clinical action, and education can build resilience in vulnerable communities. Dr. Sorensen also serves on the working group for the National Academy of Medicine's Climate and Human Health Initiative and is an author in the 4th National Climate Assessment. She is a technical advisor for the Lancet Climate and Health U.S. Policy Brief, is an editorial board member of the Journal of Climate Change and Health, and the co-editor of the textbook, Climate Change and Human Health, From Science to Practice. One of our next speakers is Dr. Nicole Redvers. She is a member of the Dininukui First Nation in Dunenda, Northwest Territories, Canada, and she's worked with Indigenous patients, scholars, and communities throughout her entire career. She is an assistant professor in the Department of Family and Community Medicine and the Department of Indigenous Health at the University of North Dakota, where she helped develop and launch the first Indigenous Health PhD program. She is co-founder and current board chair of the Canadian charity, the Arctic Indigenous Wellness Foundation, based in Yellowknife, Northwest Territory, which provides traditional, Indigenous-rooted, land-based wellness supports to Northerners. She has been actively involved at all levels promoting the inclusion of Indigenous perspectives in human and planetary health research and practice. She is also an editorial board member of the Journal of Climate Change and Health and guest issue of an upcoming special issue on collaboration. She is also author of the paperback book titled The Science of the Sacred, Bridging Global Indigenous Medicine Systems and Modern Scientific Principles. Dr. Andrew Olagunju is an assistant professor at the Department of Psychiatry and Behavioral Neurosciences at McMaster University and a psychiatrist at St. Joseph's Healthcare in Hamilton, Canada. He's a research fellow at the University of Adelaide in Australia and a collaborator on the Global Burden of Diseases project at the University of Washington in Seattle. He's been a senior lecturer at the College of Medicine at the University of Lagos and an affiliate in research with King's College in London. He is a member of the advisory board for the Institute of Neurosciences, Mental Health and Addiction, the Canadian Institute of Health Research. He is an associate editor with the Journal of Climate Change and Health and Frontiers in Psychiatry. His background includes an MBBS from the University of Ilorin, psychiatric residency at the University of Lagos, and MS in International Humanitarian Action from University College in Dublin. He has over 160 publications and has received numerous awards. He's also a founding board member of the Patella Care Foundation, an NGO in Nigeria that promotes equitable access to health services. Finally, Madeline Thompson Dr. Madeline Thompson is head of climate impacts at the Wellcome Trust, a politically and financially independent foundation which supports science to solve the urgent health challenges facing everyone. Prior to this role, she was interim head of Our Planet, Our Health at Wellcome. Dr. Thompson is also a visiting professor at Lancaster University in the UK and a retired professor at Columbia University in New York, where she previously held senior research positions at the International Research Institute for Climate and Society and the Mailman School of Public Health. While at the IRI, she served as director of the WHO Collaborating Center on Early Warning Systems for Malaria and Other Climate-Sensitive Diseases, and was co-chair of the Cross-Columbia Working Group on Global Health Security. Originally trained as a field entomologist, she spent much of her early career undertaking operational research to support large-scale health interventions in Africa. She was educated at the University of Sheffield, Imperial College of London, and the University of Liverpool. As you can see, we've got a fabulous panel for you today. And what we're going to do first is have each of the panelists introduce themselves and tell us a little bit about what they do and their special area of expertise. And we're going to be starting, I believe, with Dr. Redvers.
My screen share should be up, but I'll wait to hear otherwise. Otherwise, I'll go ahead. Just a little bit of a brief introduction in terms of the context of Indigenous peoples to this topic area. Globally, there's around 476 million Indigenous peoples. We make up about 6% of the global population living on every inhabited continent. Unfortunately, the majority of Indigenous peoples have very low standards of health and account for about 19% of the extreme poor. Indigenous peoples' life expectancy is up to 20 years lower than the life expectancy of non-Indigenous peoples worldwide. And many Indigenous groups do not have formal recognition in their respective countries. There is a large lack in recognition of adequate data, whether or not it's health or otherwise, which makes it very challenging for determining key solution-based operational goals when it comes to improving or decreasing the health disparities. And I always like to show this map because it is the process of colonization that occurred, at least within the US context, although this trajectory of population and land displacement of Indigenous peoples is occurring in multiple areas of the globe, both historically, but also contemporarily. Indigenous peoples have a deep and meaningful connection to land and place, and due to the previous and contemporary issues with land displacements, we see a lot of a platforming of risk when it comes to climate change, given these deep and meaningful connections to land. I showcase this, a picture shown by Letitia Pokiak, who's an Inuvialuit woman originally from my home territory. And this picture shows her home community of Tuktoyaktuk, completely surrounded by Arctic waters. And I'm sure you can see the potential impact of sea level rise and coastal erosion on Letitia's traditional homelands caused by climate change. And climate change impacts her Indigenous community the most, yet her communities has contributed the least to climate change. And the health impacts are already being felt in my home region, which is warming at roughly 3 times the global rate. The Arctic regions of the world have already passed the Paris Climate Agreement set at no more than 1.5 degrees Celsius above pre-industrial levels. And this is due to amplification processes that happen within circumpolar areas. Now, this land loss showcased within the previous slide in the context of coming climate change and current climate change, in addition to some of the previous relocations due to colonization, has led to a very high level of health disparity worldwide, with Indigenous peoples having higher prevalence of many acute and chronic conditions. Now, this table is aggregate US data specifically. However, we will see very similar health disparity data within Indigenous peoples worldwide, with sometimes greater higher impact ratios depending on the geographic context. And you can imagine, as noted previously, with a population already having so much health disparity, that the additional layering from climate change related health impacts significantly amplifies existing disparities. Now, there's a large crossover that I noted previously with the land map on colonization being a clear determinant of Indigenous peoples' health, but also a determinant of climate change as it pertains to an Indigenous community perspective. We've all heard, of course, social determinants of health being utilized in many contexts. However, there are very unique contexts of determinants that exist for Indigenous peoples due to the connections to land and place, as noted previously, with colonization, but also racism and social exclusion and aspects of self-determination. Now, as Indigenous peoples, our relationships to Mother Earth as our mother means that we will do anything to protect her. Yet the risk and actualization occurring in many areas, however, is the tokenization of Indigenous traditional knowledges without the consequent support for Indigenous land and place rights really ensures the continued marginalization of Indigenous people's knowledge over them as people and communities. And we do live in parts of the world, as noted by Letitia's picture, where the impacts are greatest and depend largely or exclusively on the natural environment for our livelihoods, culture, and lives. Indigenous peoples do currently host and live in relationship with 80% of the world's biodiversity, and yet live on only 22% of the Earth's surface. Yet we are still having lands taken, being killed or jailed for defending our lands, and being subject to political marginalization, leading again to some of the worst health inequities on the planet, as we have seen so clearly in the previous slide. Now, let's think about this for a moment. 6% of the world's population, 6% of the world's population hosts 80% of the world's current biodiversity. Perhaps, just perhaps, Indigenous peoples and Indigenous nations are doing something right. Why then is there the continued marginalization of their knowledges and leadership around the world? We have a world that is currently set up to consider the I, with humans as the so-called top species above all else, this anthropocentric or human-centric worldview, and at the consequence of all else on the planet. And this is compared to the Indigenous worldview of we, of ourselves as part of a reciprocal system of responsibility and relationship with no innate hierarchy assigned or assumed, this cosmocentric or ecocentric worldview or placement within our realities. So in thinking through our relationships from our Indigenous perspective, there is no separation between ourselves and that of the Earth, with complete interconnections existing that really precludes an isolated definition. We are related to our world, just as our world is related to us, as we are one and the same. So with this, if we were to think through, as an example, a decolonized microbial narrative, given the complete interdependence and interconnection between microbe, human, and planetary health, we might start to think about the micro to the meta a little bit differently. And why? Because again, all of these layers of our being in the world are completely interconnected. And I think we've seen the evidence of that through not only climate change, but also the current pandemic. And I like to take the lens of the microbiome as it helps bridge larger planetary health conversations with our own health and well-being through an intermediary, as just one example of why these environmental conversations are vital at every level of science and practice. So I'll leave it there for now. However, I'm sure we'll pick up discussions as we go on a little bit later within the event. Masi Cho, thank you, and look forward to the rest of the panelists and discussion presentations.
Our next speaker will be Dr. Olanganju, who is talking about how climate change impacts African nations, the global burden of disease, and how does it impact mental health, some Canadian perspectives.
Good morning, good afternoon, good evening, everyone, depending on where you are in the world. I'm grateful for the opportunity to talk about the impact of climate change, but I'll focus more with some of my experiences in Africa and a little bit of how this relates to the issues happening globally. And hopefully I will look forward to discussing more about some other experiences in Canada. The first thing I want to highlight is in Africa, in the 1970s, 2000, and 1990, it is easy to say that climate change is coming. But currently in 2020, we can no longer say climate change is coming. Climate change is actually here. We are blessed with a lot of green land, and so many of the things, so many indicators currently shows that we are not just a different continent from other parts of the world, but we have a lot of significant impact of climate change. For instance, the recent data collected by the World Meteorological Organization in 2022 shows that Africa, compared to so many of the other continents, for example, Asia, South America, and the US, the change in temperature in Africa is very significant. In the 1960s, there were experiences of temperature that was below zero. But currently, over the last few decades, temperature change is significant and up to about 0.5 in some parts of Africa. Compared to the level of development in Africa, this is a major and a significant change. And in fact, compared to some other more developed parts of the world, like Asia and Europe, Africa seems to be comparable in so many of the with so many of these other places. In addition, carbon emission in Africa between 1970 and 2020, notwithstanding the limited industrialization and development, has also increased significantly relatively to other parts of the world. And more recently, in fact, in the last few days, South Africa and some other islands surrounding it has been in the news because of flood that has taken over a large percentage of South Africa. And the World Meteorological Organization indicates that compared to other parts of the world, the sea level in Africa has increased greatly. In fact, much more than the global mean increase in sea level. As a result of this, internally displaced people are a major part of the vulnerable population in Africa. Data currently available shows that in some parts of Africa, as much as 300,000 people in the last 2-3 years have been displaced because of disaster, not conflict, disaster. So when we look at all these, the question is, for Africa, due to the relative impact of climate change in Africa, do we have to do anything? And the answer is a resounding yes. And for us as researchers in life sciences, in biological sciences, the question is, what can we do? In my slide here, I actually have like 4 different areas that I think as scientists and as researchers that may help us look at how we can support and mitigate the impact of climate change. One of the things that I think is important for us to think about is to think about the impact of climate change on our environment and ecosystem, our environment. And what can we do as scientists regarding this? What we can do is to promote sustainability, green energy, and to buy into the global move to reduce carbon emission. A lot of our laboratories in Africa, I can give you an example of Nigeria. A lot of the laboratory, because of poor power supply, are powered by diesel or fuel power generator. And this further compound carbon emission. In so many parts of Africa, there is a change and increase in the burden of climate-sensitive diseases. And the global burden of diseases has shown that Africa currently accounts for more than 93% of death from malaria, dengue fever, and yellow fever, largely impacted by the change in climate change. For instance, increase in rainfall that makes the ground to be wet, and increased temperature that helps organisms that promote malaria transmission like mosquito to are banned. I think also as scientists, we need to join the effort to create awareness. Some of us, I'm a psychiatrist by training, but I educate people. I talk about climate change. So it will be good and very impactful if we join the effort to create awareness. Complex emergencies are very, very critical and seems to be impacting a lot of the activity in Nigeria. Food insecurity because of drought has increased. So promoting green energy and climate protective use of land is very, very important. And lastly, as I wind up, I also want to stimulate us because I know we are researchers and we need to use one of our skills. And one of our skills is to help create and address knowledge gap. So I will encourage us to consider publishing our findings, looking into the intersection between climate change and our different subspecialty, and publishing and reading about the impact of climate change in notable journals, including the Journal of Climate Change and Health, in which so many of us are panel or editorial board. Thank you. I will look forward to further discussion during the panel meeting.
Thank you, Dr. Langunju. Our next speaker will be Dr. Madeline Thompson, and she is going to be speaking about climate change and how it impacts maternal and child health in lower and middle income countries and other global impacts from the perspective of Wellcome, a funding organization.
Thank you so much. I'm absolutely thrilled to be here. While the slides come up, I will address the issue of maternal and child health, which I think is a particularly important issue for looking at health disparities in the context of climate change. But before I do that, I would like just to give you, the audience, a little background on the organization that I work for. The Wellcome Trust is one of the largest foundations in the world. It is a health funder and historically, and it's based in the UK. Importantly, it is financially independent and politically independent and is able to focus its resources on its big priorities. In the last 2 years, the organization has gone through a major shift in its thinking, and it has changed its vision from one of achieving the greatest health benefits by funding the brightest minds to a new strategy, which is around supporting science to solve the urgent health challenges facing everyone. And this shift is an extremely important shift for us as an organization. It means that we have to concentrate our efforts on and our considerable resources on some of the most important issues of the day. We are well known for funding discovery research and particularly biomedical research, and that to a certain extent will continue. But our other activities are now going to focus on areas that we do well, such as infectious disease. We've done a lot of work on COVID and other areas. Mental health, which is a new area that in need of funding, and I think has become increasingly understood as a major health issue worldwide, and climate and health. And for a major funder, putting climate and health center to its strategy is a really exciting opportunity for the trust. And we had a statement from our CEO last month that we will be spending about 16 billion over the next 10 years to fund this strategy. And the money goes into basically not only funding the research, but also funding that interface between research and policy through a whole range of activities, including engagement with the public. So just very briefly, we are still early on in our strategic development in climate and health, but the things that we are going to do and are already doing is generating and synthesizing new knowledge about health risks and vulnerabilities caused by climate change to accelerate climate action. And I think everybody here knows that we need to act a lot faster than we are currently doing. We want to be able to develop and evaluate and advance actions that are designed to reduce the negative health impacts of climate change and build a transdisciplinary field of climate and health researchers and practitioners. So the long-term outcomes that we seek are the rapid reduction in greenhouse gas emissions in a way that maximizes health benefits and avoids negative impacts, limiting, of course, the global heating in line with the Paris Agreement. And on top of that, because we know we've already got inbuilt emissions, we want to help achieve successful adaptation and resilience strategies that minimize the health impacts caused by the unavoidable climate change. Now, we know that funding research globally, and particularly concerned about health disparities, most of the studies on climate change and health, as reported here in a paper by Baring-Ford and colleagues, most of the research is done in the northern high-income countries, and most of the research is done by northern and high-income researchers, even if that research takes place in Africa or parts of Latin America or Asia. And that's something that we would like to help address. We also have, from this publication, we can see where the effort has been concentrated in the research to date. There's been a lot of work on respiratory disease. So the main thing from this slide, and it's a bit of a distraction having slides, is that just looking at what work has been prioritized to date. And it's very much been around emissions and air pollution, which is obviously an extremely important thing. And that's why you see a box in black on the right-hand side, and other areas around infectious disease. And the area that I've marked in red is the maternal and child health, which has actually had very little research across the board. And one of the things that we're particularly interested in at the Trust is a focus on heat and maternal and child health. And you might ask why. And it goes back to understanding who is most disadvantaged, who will suffer the biggest impacts of climate change. If you just think of maternal and child health, there are about 2 billion children that will be born or under the age of 5 between 2015, when the SDGs were started, and 2030. All of those, because they have had no contribution or very little contribution to climate change, but will actually be suffering effects that are far worse than our current generation. So there's a real generational and intergenerational impact. And then if we look at women, women are socially disadvantaged in many areas of the world, in particular around income, in also that women basically make up the poorest large group of people on the planet, very often dependent on natural resources. Smallholder farmers in Africa come to mind in particular. So they're vulnerable, if you like, through gendered disadvantage. But on top of that, when they're pregnant, when they're nursing, when they're looking after young children, they're also biologically vulnerable. And so bringing these different elements together gives us an interest in focusing some of our work initially on maternal and child health, and particularly biological vulnerability in disadvantaged populations around the world. Part of Wellcome's new strategy as well is to put diversity, equity, and inclusion at the heart of our long-term strategy. And as we move into this space, we are starting to put out calls for funding. We've recently had one on heat adaptation, evaluating interventions to help manage the health effects of heat. This now closes on the 31st of May. And It's primarily aimed at lower and middle income country principal investigators. We will be having, and this is a teaser if you like, a call coming out in late May, focusing on biological vulnerability to heat in maternal and child health, prioritizing disadvantaged populations. And again, we'll be looking at diversity, equity, inclusion in the way that we fund and who and how we fund. So I'm looking forward to the further discussion. I just realized my voice is beginning to go. I have a bit of a cold, but I shall leave it there and look forward to the discussion.
Thank you very much, Dr. Thompson. Our next speaker is going to be Dr. Cecilia Sorensen, and she's going to be speaking about how climate change impacts emergency medicine. Dr. Sorensen?
Thanks, everyone. Thank you, Dr. Alexander, and thank you to all the panelists for your really inspiring talks. Today, I'm going to be speaking about climate change and emergency medicine. That's where I really started in the field of medicine and where I still spend a lot of my time. So when I work in a busy trauma center, we see surges of patients come in during various times of the year and for various reasons, and the ER can get incredibly chaotic. And often what happens during these times is that people start talking about the full moon, right? It's as if we know something is going on out there and it's impacting our society and our systems, and we can't put our finger on it. So we resort to ancient superstition. But I would argue that it's not the full moon that's causing our ERs and our hospitals to fill up, that it's really the climate. For example, we're seeing this in the news and we're seeing it throughout our scientific literature that climate-related impacts such as extreme heat are leading to overwhelming impacts on our health systems. We're seeing events such as hurricanes that are forcing hospitals to evacuate and hospitals to close. We're seeing wildfires causing respiratory illness among communities that are located near wildfires as well as far away that are resulting in surges of patients coming into hospitals, and so on and so forth. So what we really find at the end of the day is that climate change, I would argue, is a disease of vulnerability, of disasters, and of emergence. And hospitals and emergency systems are really on the front lines of this due to our role as safety net providers, as leads of command during disasters, and because of our de facto role in detecting and diagnosing sentinel disease presentations. So I'm going to dive a little bit more into each of these. So as I mentioned, climate change, I feel like, is a disease of vulnerability. And what we know from the most recent IPCC 6 assessment report is that climate change is worsening health inequities. So although no part of the world or individual is immune from the health impacts, the most devastating are occurring and will continue to impact people and places who are economically and socially marginalized. So just for an example, in the US, we know that nearly 2/3 of the impacts and costs of climate change are being shouldered by our Medicare and Medicaid patients. And this is a theme that plays out globally. Research from the World Bank Group predicts that climate change will push up to 132 million people into extreme poverty by 2030, undoing years of progress on sustainability development goals. And this is primarily due to the impacts of climate change on health and livelihoods. So I would also argue that climate change is a disease of disasters, and it creates health impacts resulting from these disasters. So looking at this map, this is data from our National Oceanic and Atmospheric Administration. And what we see is that in 2021 alone, there were 20 climate-related extreme weather events, each which led to $1 billion in infrastructure damage, not even beginning to account for the health impacts and the associated costs. And we know that these are occurring in the acute, subacute, and chronic phases. And here what we're looking at is that over the past 40 years, there's been a clear increase in the number of climate-related disasters, and this plays out globally as well. Here we're looking at data from 2020, and we're looking at people who were displaced due to conflict and disasters. And in the blue, what we see are the disasters that are causing people to be forced to migrate from their homes. And of these disasters, we're seeing droughts, we're seeing extreme temperatures, wildfires, and floods. And these are all climate-related or climate-driven and fueled events that are leading to mass displacement. So the last thing I want to say is that climate change creates diseases of emergence, right? Around the globe, we're seeing that common and uncommon diseases are changing their incidence, their prevalence, and their location. And this includes both communicable and non-communicable diseases, such as vector-borne infections, respiratory diseases, heat stress, mental illness, waterborne diseases, food insecurity, displacements, and trauma. So we know this is happening because of the recently released IPCC report, which looked at 11 categories of diseases and health outcomes, which together comprise 70% of global mortality. And all of these were found to be climate sensitive. So let's take a closer look at those. When we zoom on this list, we see that malaria, dengue, diarrheal diseases, as well as NCDs such as diabetes, nutritional deficiencies, respiratory diseases, and cardiovascular diseases are all climate sensitive, meaning that they're changing their prevalence, their distribution, and their intensity under changing climates with high to very high confidence. And that's indicated by the number of stars next to the specific health outcome. So although there's a lot of really hard news that is given in this IPCC report, there's also some good news. We have windows of opportunity. So for example, climate solutions, which are already market ready, which benefit our health and our economy, far exceed their costs of implementation. And furthermore, we know that well-designed strategies which reduce greenhouse gas emissions and strengthen our resilience have significant benefits for health and well-being, such as cleaner air, cleaner soil, cleaner water, which we know are associated with improved mental health, more active and resilient communities, healthier diets, and so on and so forth. We also have another opportunity. What we know is that the severity of climate-related health risks is highly dependent on how well health systems can protect people. So said another way, these widespread impacts, which we're all talking about today from climate change, are not inevitable. We as health professionals and we as the larger research community have a huge ability to make an impact on this and to buffer these impacts that we are talking about, as well as work towards reducing the root cause of climate change, which are carbon emissions. So thank you so much. And with that, I'll turn it back over to Dr. Alexander.
Thank you, Dr. Sorensen. Now it's going to be my turn to speak, and what you're going to hear now is some information about climate change and disability and how people with disabilities are disproportionately impacted. By training, my area of expertise is physical medicine and rehabilitation. So here we go.
Over 1 billion people live with disabilities. These include people with chronic pain, brain injuries, Parkinson's disease, multiple sclerosis, ALS, spinal cord injuries, and strokes. People of all ages with cognitive and psychiatric issues or severe autism. These include people with amputations and arthritis, those that are hearing or visually impaired. Living with a disability can be carbon intensive. Equipment like wheelchairs and ventilators, supplies like gloves and bladder catheters are unfortunately made of plastics and not biodegradable, and these must be used many times daily. When disasters strike, people with disabilities are more likely to be injured than the able-bodied. They may be unable to hear or understand warning signals, might not have the mobility to escape danger or go to a shelter, and even worse, may be barred from shelters due to a need for assistance or inability to stay in a cramped environment. People with disabilities don't live in a bubble. Many are also part of other vulnerable groups and have concomitant medical problems. Yet little is discussed about the needs of persons with disabilities in relationship to climate change. Perhaps this is because people with disabilities haven't advocated for their concerns as strongly as other groups. Or maybe people with disabilities have to focus on survival, not self-actualization. Regardless, a comprehensive collaborative approach and solidarity between the disability, health, and scientific communities is overdue. We need qualitative and quantitative data about the concerns and solutions people with disabilities have regarding climate change. The information needs to be based on type of disability, residence, socioeconomic status, and particular risks. To accomplish this, An international collaborative network of clinicians, people with disabilities, researchers, and developers is necessary to create targeted interventions. We must also expand our knowledge in two other areas: mitigation of the impact of the supplies and equipment that's needed, and development of inclusive, accessible methods of adaptation. People with spinal cord injuries have paralysis and sensory loss, but they also have poikilothermia, causing greater risk in temperature extremes, loss of bladder and bowel control, and are prone to pressure ulcers. Their lives are carbon intensive. In addition to catheters, they use wheelchairs and braces. They are at risk though. The woman in the picture here has a spinal cord injury and was in Puerto Rico during Hurricane Maria. As she helped others with spinal cord injuries, people were actually sharing catheters because of inability to get supplies. In extreme heat, there is also an increased risk of elevated temperature progressing to heat stroke, unawareness of bites, which could cause infectious disorders, and dehydration, which can cause urinary tract infections. People with spinal cord injuries don't live in a geographically distinct area where their needs can be addressed. Thus, we need to develop targeted early warning systems so people with spinal cord injuries are aware of the risks and they have access to appropriate remediation during extreme heat. This requires technology and accessibility, even if the person's already living in a vulnerable place or in a place where disability concerns aren't even addressed. In addition to developing methods and testing solutions for extreme heat, we need to look at the biodegradable and carbon neutrality of supplies and therapeutics. And we need to make sure people with disabilities are able to sustain their abilities, quality of life, and ability for community preparation. Community can be one of the most important issues for people with disabilities. The issues are complex, and the issues of people with disabilities are quite dissimilar to environmental justice in cases such as redlining. Multiple forms of inequality based upon disability, residence, and socioeconomic status confound the problem of the climate crisis. Thus, we must use not only local or international, but multi-scalar analyses of the causes, consequences, and solutions. These require more than just inclusion and negotiation, but also a multifaceted approach through research at a biomedical and engineering level and through improved communication and collaboration. A community-based approach where people get to know their neighbors and they can help in terms of awareness and safety in disasters is important, such as we are doing through Day for Tomorrow, but there also need to be international solutions developed and tested in collaboration with the public and private sectors and people with disabilities. As we all move together into a future which bodes to be living in a crisis situation, we must ensure all living beings, regardless of abilities or disabilities, are valued and their lives are not dismissed. Thank you.
I want to say thank you to everyone for all their presentations. And what we'd like to do now is I have a few questions I'd like to bring up to the other team. I did get an ability to speak about research issues associated with disability, but I think it's important that we talk about all the areas of disparities and really talk about what the current research is showing us about human health. What do we know in vulnerable populations? What do we need to do to intervene? And where do we need to specifically focus research to achieve equity? And I think what I'm going to do is start here with, we'll go in the same order that we've started in, starting with Dr. Redvers, and then we'll move on. So Dr. Redvers, do you want to start in this area?
Yeah, sure. I think it's important because, you know, one of the things that becomes challenging sometimes when we're dealing with, biomedical science in particular, is trying to think through how those micro narratives, relate to these wider global kind of problems. And, we haven't done such a great job as communicating as scientists to public stakeholders, to community groups. There's clear evidence along those divides, but also a lot of mistrust that's been occurring within scientific narratives. And one of the things that I think has been minimized in terms of the opportunity of this space is using story narratives in science to inform greater movements like those within climate change and health, planetary health, One Health. And I spoke briefly before about this issue with our human-centric narrative that often occurs. And I think there's actually great opportunities for utilizing microbial, but also micro level metabolic, regardless of what sort of scientific discipline that we're in, molecular narratives, really to inform narratives that unite all life on Earth. And the foundation of these, what I call decolonizing narratives, are really premised on the need for rebalancing our biomolecular function within, but also across species, while dampening this sort of supercilious viewpoint that human health should be put ahead of all others on the Earth. And the indigenous community research of researchers have really sort of foundation not only the applicability of Western science, but also considering what I call a two-eyed seeing approach, which was formerly coined by Albert Marshall, who's a Mi'kmaq elder. And two-eyed seeing is basically using one eye to look through the world through the Western view of scientific thinking and knowledge, and the other view to look through it from a traditional knowledge perspective. So the gift of seen from multiple perspectives. And we haven't utilized that opportunity at all, frankly, when it comes to scientific research as it pertains to health generally, let alone the climate crisis. And I think is really an opportunity for how we think through moving these research initiatives forward, given the strengths that we've seen from Indigenous communities on their environmental stewardship.
I think that's a very important point, the issue of having the lens of the group of individuals that is participating in the research and what the research is focusing on. Dr. Olanju, would you like to add to this?
Yeah, thank you so much. It's been great listening to all the panel members. First, I want to make some comments, one on Africa, two on mental health, and then maybe one or two regarding people who work in life science and biological sciences. Regarding Africa, just to continue the discussion that has been spoken about from indigenous perspective, I think also in Africa, currently there's limited data about the impact of climate on different sectors. So we need to support people in Africa to improve data collection, and then not just data collection, the dissemination. I'm so glad to hear about the effort of Wellcome Trust. I think other people need to come on board. I'm also glad about the effort that some journal, including the Journal of Climate Aid and Change, they are doing to help researchers in Africa understand the impact of climate change, but not just for them to know about it, for other people to know about it. It is also important that policy regarding how to manage climate change is promoted among people in Africa. And as researchers, we have a lot of input to that. Policies are usually driven by knowledge from research. So currently, I was reading that only 2 countries in Africa have signed the agreement of the emission net zero. Only South Africa and another country close to it, Botswana, have signed the agreement. So there is need for us as researchers and to see how we can use our skill in research to help people in Africa to disseminate, advocate, and improve the reach. I'm happy about what the consortium is doing, educating health workers across the globe, not just from the West. So I think that's a great effort. Regarding mental health, I think we need to support research also in Africa to understand the burden of the intersection between climate change and mental health. Screening instruments have been validated to assess eco anxiety, eco depression, and grief in so many parts of the world, but I've not seen any validation done in Africa. And we do know that Africa is multicultural. So a validation done in one culture may not be valid in another culture. So I think validation, the development of instruments to assess burden is very, very important. And regarding biosciences, I think the impact of climate change will not just have impact on our physical health. I'm curious to see whether people who are working in biological science can take it further and see whether impact of climate change is affecting our epigenome, our genetic composition. How is that impacting on it? So I think there is a lot of knowledge gap that needs to be filled. And I think this kind of forum will allow a cross-pollination of idea, team science, very needed. And I'm very happy that we've also heard about funding opportunity. I know we cannot do research without funding. So I think this discussion is rich and balanced. I'll just stop there. Thank you.
Thank you. Dr. Sorensen, I would like it if you could talk a little bit about one of the points I think that both of our speakers just brought up, and that's the issue of collaboration amongst disciplines and in different cultures and communities. With your background in policy, how can we really transition from collaboration in our research and communication into action?
Thank you so much for that question. I think this is so essential. You know, research and the scientific community has this huge imperative when it comes to climate change to think about how we can answer the questions that our policymakers have. You know, there is a huge need for doing basic science research, but we also need to be attuned to what's happening in the policy realm. What are the levers that our policymakers have in terms of decision making, and how can we empower them with data and science so that they make the best decisions? You know, a great example of this is a study that happened in New York City where the city was evaluating different types of regulations around air pollution. And what scientists were able to do really quickly in the moment was be able to show, you know, if you go with this regulation on air pollution, it's going to result in this many increased asthma exacerbations coming into ERs, this many potential, you know, deaths from COPD or from other causes of morbidity and mortality from air pollution, versus if you do this solution, these are the health benefits you're going to see. And so when you're able to frame those types of options for policymakers, they have a much easier time making good decisions for our health, right? So I think that as researchers, you know, we need to evolve into a space where we're able to understand what our policymakers need to make the critical decisions that impact the health of communities. And I would say, you know, in the US, we're faced with this paradigm where climate change is highly politicized, right? And I think that health, when you talk about it, can really help to break down those barriers, because we're not talking about political candidates. We're talking about the health of our grandparents, the health of our children, and the health of everyone around us. And so I would say, you know, the more we can communicate with our policymakers, the better. And in order to come up with good solutions for policymakers, it requires incredible interdisciplinary action, right? You know, teams of basic scientists coming together with epidemiologists, coming together with clinicians, and most importantly, representatives of communities who are being impacted to come up with the solutions that we need. So I'll leave it there and turn it over to Madeline, because I know she's done so much work in this space.
Well, thank you. I mean, there were just so many interesting points that came up here. So I just want to touch on a few of them. First of all is this idea of transdisciplinary science. It's not just the scientists talking across disciplines anymore. It really is about how to bring in the policymakers early on to help drive the questions, which is what you've just pointed out. And then not only that, but also the affected communities who's basically going to live with and have to present like what is in their interest, if you like, as a result of the science. So I think this is something that Wellcome has invested in under its previous strategy through the Our Planet, Our Health program. And that is quite long-term substantive grants. because you need to be able to bring on a broad community. And we're currently going through, what is the learning of that process? One is it takes time to establish relationships, particularly political relationships. And they are kind of vulnerable as well to shifts. You know, you have a new election cycle, the change in the mayor, etc., can change the opportunities that are created by the science. So the scientists have to be flexible. They have to have a political nous, if you like, to understand what is happening in the political process and to be as effective as possible in terms of delivering their science. So I think that transdisciplinary component is really, really important in the work that's going to go forward. The other thing I'd just like to pick up on as well, Andrew's comment on data issues. And the thing about having data that is locally relevant and locally owned. And I think that's another fundamental issue, because it's very hard for policymakers to say, yes, we're very concerned about this issue, and you are in Senegal and somebody shows you the results for Delhi, yeah, and says this is what's happening in Delhi. It's very hard to say, well, that's obviously what I need to do in my city. You need to generate the information locally. You need to be able to, as you said, CC, to be able to show the different options. That all has to be done locally, and it can only be done locally if you have local scientists who are able to do that, and they have the data, they have the tools, they already have the engagement with the policymakers, and if they need to be supported externally by other scientists, whether in a South-South collaboration or a South-South-North collaboration, great, but it has to be, at the end of the day, done locally. And I think understanding that is also an important part of developing the change that we need to see.
And just to chime into that, Madeline, sorry, I'm just talking here. You're triggering so many great ideas, which is that, you know, we need local expertise. And part of that is that, you know, as scientists, we all need to understand how to apply a climate lens to the work that we're doing. And I'll just give an example. For example, if you study asthma, or you study COPD, or you study any disease process, how does climate change impact that exact area that you're studying? You know, on any level, on the cellular level, on the epidemiologic level, how does it impact that? And we have to be able to think as scientists, you know, how is climate change going to impact this? Because quite frankly, if we don't do that, our science is going to be irrelevant in 10 years, in 20 years, when we are dealing with some of the worst impacts of climate change. And so, you know, I would say education is so key in this. And this is why some of the work that we're doing now is really thinking about how can we strengthen local, regional, national health systems to have people who understand the deep intricacies of climate change and can really serve as the glue to connect science to policy. And I'd love to hear what Nicole thinks about all this and how we can incorporate, you know, the wisdom from Indigenous peoples who obviously totally understand how to live in harmony with our systems. And how can we learn?
Absolutely. Well, I think one of the most fundamental points when it comes to Indigenous science, because we don't hear about that a lot. What is Indigenous science? And Indigenous science is nonlinear. It's contextual. It's metaphoric. It's not defined by space and time. And those are hard concepts to understand from a Western perspective. Probably the closest connecting point would be systems thinking and complexity. And here we have a climate change scenario in every single discipline that's calling for an approach that's systems thinking based and understands the importance of complexity. So that's the connecting point. And systems thinking is based on relationships. Indigenous communities and their sciences are relational. It is completely and fundamentally rooted within the relational aspect of the natural environment and its impacts not only on community members, but also on plants, on animals, and the ecosystem at large. So there's a lot of learning here that I think is unappreciated as the component of system thinking and complexity is embodied in the innate worldview of Indigenous communities. They have been doing systems thinking for thousands of years. They are the experts in it. Yet we're not mobilizing that level of knowledge that comes through because of the differences in how we communicate knowledge and sort of the standard approaches between what we consider evidence-based and evidence-informed.
I think as we go into the other areas of research here and the other questions, something that I think is also very important to talk about is the issue of sustainability. And I'm wondering if Dr. Thompson can talk a little bit about the perspective from Wellcome in terms of the net zero emissions plans for healthcare systems and how the research community can transition over into this net zero concept.
Well, thank you. Well, first of all, I think those of you who followed and participated, I know, in the COP26 process, one of the really exciting things to come out of that was the commitment, first from the UK, from the National Health Services, to a net zero health system, which was followed with pledges from, I think, over 50 other systems in other countries, including the US federal health systems. And that is to move the health systems in line with the rest of the world, if you like, the plans for net zero at the national level. So, and that in the UK, that's creating an alignment, if you like, between what's happening in the national health system, between what and the government's pledge for a net zero society by 2050. I think that's a very exciting and brave process, because a lot of the solutions we don't quite know yet. We need research to find them. We need to enable the health service staff, etc., to be part of that solution. At Wellcome, we have are in process, if you like, of developing our own net zero strategy. So we have it for investments. We have our investment strategy, which is available online, which has a net zero by 2050 strategy. We are looking at how that works for the whole of the organization. And in that process, learning how we look at supply chains, how do we think about our, the carbon footprint of all the research that we fund. We own that carbon at the end of the day, if we fund it. So then we have to start thinking about what does it actually mean for a net zero health research community? And that's something which is, there are some early attempts, I would say, to do that in different parts of the world. I know our colleagues at the University College London next door have built tools for medical research laboratories to look at sustainability issues, to be able to see how they're doing in terms of reducing not only the carbon, but water use, etc. And I think that's something that the health research community hasn't really thought about very much. We've had that big move in the health systems community to go for net zero. We also need that move to happen in the health research community. And there's some obvious places where you can start. One of the things now, if you apply for Wellcome funding, there will be travel will be an issue. It's like, are you considering the carbon footprint of your travel? Is your travel essential? Not that you can't travel, but it needs to be justified. And there are opportunities at the moment to offset carbon from travel within the grant structure. Other innovations we hope will be coming further down the line. But I think this is a bit of a wake-up call for all of us to think that it's not just the government that has to do something. It's not just the health systems that have to do something. It's not just the big companies. It's also the research community itself. And I'd be very interested to learn, actually, from the audience and others, what's happening elsewhere in the world in terms of moving health research towards net zero.
Yeah, just to go along with that, Madeline, it's really exciting to see, because there's so many different levers we have. We don't just have to wait for government to move on this. Funding organizations can move on this. We can move on this within our own institutions. Just to throw a little bit of data behind, the impact of the health systems on greenhouse gas emissions and on climate change, we noted that if we gathered together all the health systems globally and totaled up their carbon emissions, that they would equate to being the 5th largest emitter of greenhouse gases on the planet. So we're stuck in this really bad trap where, of course, we do incredible work, incredible research that's so much needed for our planet and for health, but inadvertently we're doing harm in the communities we serve. Right. And so we're stuck in this really, I'd say, unvirtuous cycle, but we have to break out of it, and we can break out of it. And there are health systems who are leading this. The UK has been really in the forefront of coming up with strategies to do this. Right now, I'm part of the National Academy of Medicine Working Group on health sector decarbonization, and we are really strategically looking at supply chains. We're looking at building operations. We're looking at how do we educate people who work in these systems to make this easy for them, to make this part of their work, to make them want to do this, right? Because at the end of the day, none of us wants to be part of the problem, but our systems are constructed in a way such that we inadvertently are, but we have to realize our power in changing them. And I think all of us as scientists and as researchers have that opportunity, not for blame of ourselves, but for reflection and thinking, how can we do this better? Because there are solutions and they're out there. And, we're stuck in this, I would say, the largest problem with climate change is this is truly the failure of, the commons, right? It's a tragedy of the commons. And we all have a little piece that we can play in this for the better. So.
Thank you, Cecilia. Just for me also to add to that wisdom, we all have little action that we can promote. In Africa, for instance, land use is a major issue contributing to carbon emission. So promoting green environment, planting of trees around our lab, maybe it may look little, but when you look at the different labs across Africa, then it will go a long way. And our day-to-day work as scientists, promoting sustainability in the things that we use, promoting green energy, talking about it, using recyclable materials, those are small action. And it may not require the government. So as individual, I just like the way Cecilia said that there are small solutions. Or as individual, as scientists, what are the small things we can do to lend support to this discussion? Let's think about the small solution in a concentric way, and then maybe in the larger way, the bigger intervention.
I would just add another comment to the issue of sustainability. And I think in some ways we need to give ourselves all kudos now for what we're doing. The issue of virtual education, I think, is so important. If we want to think about research, we've also got to think about all the work we've done virtually and how by meeting in this forum, it is not only less carbon intensive, but we are also improving equity for people that can attend meetings virtually when they couldn't be attending them in person. So I think that's another area where, as we move forward in terms of research and improving equity for people, we've all got to keep this in mind. And I think similarly to this, by educating people virtually, the other thing I think we need to keep doing is using virtual tools in our research and using it in our clinical care.
Thank you all. We have a really great question from the audience, which I think is going to be so fabulous for this panel to discuss. So the question is, how does climate change affect the emergence of novel human pathogens? Are we at more risk from these pathogens and perhaps even another pandemic? So I know this is something we've all been thinking about so much over the past 2 years, but Nicole, I'm sure you have some really interesting thoughts on this, not to put you on the spot, but curious what your thoughts are on pandemic, on pathogen emergence and climate change.
Absolutely. Well, one, if we could say, story that's been passed on through generations in my region is that there would be a time when the sickness would wake up from the ground. And what we're seeing very clearly with the event of a indigenous community in Siberia being infected with anthrax from an animal that had emerged from the melting permafrost and spread to the family, who actually killed one of the children. That literally, from the melting of permafrost, we're seeing the release of new and old variants of infectious disease that have impacts. And I don't think there's a better example than that to showcase the impacts of climate change and how it has the potential of impacting human health in the context of infections. And we just don't know what else is lying within the permafrost melt that will be occurring, not only from an infectious standpoint, but we have an issue in my home region of mercury release with the permafrost as well. So it's not only from an infectious perspective, but also from a contaminant perspective as well.
Wow, that gave me chills. But yeah, thank you so much, Madeline. Wondering what your thoughts are on this.
Well, the two things that jump to mind, of course, is just this intersection, which is humans and the forests. and the deforestation and that increasing interfacing of humans and the natural world in a way that provides greater opportunity for spillover events to occur. And the other one, of course, is our farming systems, where we, sort of house thousands and thousands of animals in fairly cramped conditions and provide an extraordinary environment, if you like, for pathogen emergence as well, which we've had with flu associated with pig farms. And so the sort of, just globally, the way that we're living at the moment with this very rapid communication around the world, where a new pathogen can be halfway around the world in a few hours, and incredibly hard to prevent. It's just all of those interfaces. Now, where does climate change fit into that? Well, with forests, obviously, climate change and forests is absolutely essential that we keep our forests. They create carbon sink that keeps our planet healthy, and deforestation is a major part of the problem that we have with climate. What does it mean about livestock? Well, livestock also a major part of our climate change challenge. We know that the use of land and foodstuffs for animals and livestock, as opposed to a plant-based diet, not only increases carbon, also increases, if you're thinking about cattle, methane production, which is an incredibly dangerous emission for short-term. Sorry, I'm actually losing my voice a little bit at the moment. But just each of these interfaces where you see the potential for spillover events are associated with our carbon emissions and a way we have to change the way we live in the world. So I think it's a very important question. And I think that we haven't really focused the science on spillovers. We have got an enormous amount of interest going forward now with pandemic preparedness and being able to do surveillance of pathogens as they emerge, but less thought going into, well, where do these spillover events occur? And is there something that we could do that would not only benefit the climate, but would also reduce the likelihood of them happening in the first place?
And also to thank you so much.
Parallel. I would just add, somewhat in parallel, I think with all the deforestation, one of the things we need to think about is the impact on people's mental and physical health. Forest bathing is well known for being something that's good for people in terms of their mental health. But as we get busier and busier, and there is more deforestation, and there's more work, 24-hour doing this, being on phone constantly, we need to go back to that balance. And I think that's another issue that we need to think about in terms of climate change, is by doing the actions we need to do for the climate, at the same time we're doing things for our own physical and mental health.
Andrew, go ahead.
I think, just to take it up from some of the discussion, the impact of climate change actually makes it more challenging for us to even deal with pandemic or mental health issues. During the recent pandemic, some people have looked at what was the impact of climate change and the complex emergencies to people being able to follow the public health advice. For instance, in some parts of the world where there were a lot of internally displaced people, and they had to be put in a big crowded area. And that time, we know for the COVID pandemic, one of the things has to be distancing, social distancing, it is called. So the pandemic was difficult to manage in terms of those public health intervention. Some emerging trend as well in some parts of Africa and Asia shows that some population that in the past were not vulnerable or were not reporting some infectious diseases are beginning to report it in the island, because the vector that is transmitting disease because of the change in temperature and the precipitation, are able to survive in those altitudes. Our environment, just as Madeleine has mentioned, is very important to our emotional well-being. The aesthetic of our environment and the comfort in terms of temperature has a significant impact on our emotional well-being. Imagine evidence from literature clearly has linked increase in temperature to increase in the risk of suicide and aggression. So climate change has different and a wide ramification on our mental health. I remember talking to a local in Africa, and he was talking about the changes that has happened because of industrialization of their city, how the green environment has changed, and was talking about the probable intergenerational impact, and was telling us stories and folks. He told us, he said in the past, as a community, they come in the evening under the green environment to talk about folks and stories. But currently, they have no such connection. And he told us the importance of that connection, that during those times spent outside in the environment, an environment that is conducive, they know more about each other, they connect better, and they provide support and build community resilience. I think there's a lot we are missing with all these changes in our environment regarding our mental health, resilience, and the ability to adapt that we were beneficial of in the past. I wonder whether Nicole, because I do know that indigenous people have a very close connection with the environment. I wonder whether you have one or two things to say regarding that.
Yeah, absolutely. I'll just sort of make a final point on that in terms of note. And there was a group of Indigenous people that got together last year to codify what we called the determinants of planetary health. And one of the key thing that bridges your conversation, but also what Dr. Alexander was talking about before, is this importance of the interconnection within nature. And we had clearly stated that ecological demise that we've seen really points to an impaired human relationship with our inner self, because humans are nature and not a part of it. I often talk to scientists here to explain this interconnectivity when Indigenous people say that I come from the mountain or I come from that lake. That if you're drinking the waterway from the aquifer, from the river that's next to you, from the river that's next to you, your body's made up of 60% water. You are that river. You are that land. You are part of the land. You are not separate from it. Yet, because of this disconnection that we've had, it's really, manifested ourselves as this fragmented and disassociated identity that really cannot recognize itself as a part of a system. But that also makes it very much easier to project predatory and abusive impulses onto the environment, and bridges this sort of ideology of independence, this ideology of entitled ownership, and a kind of utilitarian perspective of the natural world that really relates to it through transactional relationships that don't really have a sense of responsibility, care, or love, which of course will continue to perpetuate the issues that we have. We are of nature. We are the river. We are the lake. Our carbon comes from the distance exploded stars. We are absolutely of nature. And we need to remember that as a part of how we live our daily lives, how we connect through our relationships. We are nature. We don't go out in nature. We are of nature. Now, I unfortunately have to pop off. So maybe I'll sort of leave that as my final emblematic comments to sort of connect this piece. But I just wanted to say Masi Cho to everyone. I think this is an incredibly important topic. There's much to discuss that we have today that just touches the surface, I think, of many of these, and hopefully inspired some folks to think through, how their work may be able to connect that meta to micro to meta to narrative, from the work in labs to this greater planetary purpose that we have because of being of nature. So Masi Cho to everyone. Thank you.
Thank you so much, Dr. Redvers. Thank you to
so
Dr.
much.
Alexander, and to all of you for being here today. This is the first of a series in the subsequent series, we will dive into deeper issues related to heat, related to air pollution. But this has just been an incredible exploration into the various facets of climate change, how we are part of climate change because we are part of nature, and how we can change our relationship to this paradigm. So, Dr. Alexander, I'll turn it over to you for any closing remarks.
Well, I would just say that anytime I hear Dr. Redbird's talks about how we are part of the earth, it sends chills down my spine because it is so, so true. And I think, you know, the solution to humanity's collective future is to be together in community and collaboration and work together as a team, from scientists at the micro level to you know, diagnosing very many things, but also at a macro level, so that we are realizing that what we do impacts the earth and it impacts each other. And you know, I'm very honored to be here today with all of you and everyone in the audience. I think, you know, what's key is we all keep working, and we all keep working collectively for all of our future and the future of the planet.
Thank you all for being here. Really wonderful. And we'll see you on our next session coming up in just a couple weeks to months. So stay tuned. Thank you all so much.
Thank you all.